Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center. I should say good morning because it is 10:15 on your Thursday morning, and we are talking with Dr. Mashika Roberts. Wanted to get her pretty quickly after the governor announced last night that the statewide health orders would be lifted here in 3 weeks. Dr. Roberts, I want to get your initial thoughts on this. Do you think it is safe? Do you think Ohio and Columbus are ready for these health orders to be lifted on June 2nd?
Well, obviously, the COVID-19 pandemic is still with us. It is not over. Our numbers are moving in the right direction, which is very promising, but we need to get more people in our community vaccinated. And what I really am concerned about the most is when these health orders are lifted on June 2nd, what that means for our community members who are not vaccinated. The risk is going to increase for them if they are not vaccinated, and social distancing and mask wearing is no longer being followed.
What is the strategy right now to get more people in Columbus, in Franklin County vaccinated? Because we are on par with the statewide average, but the statewide average isn't great compared to other states and other surrounding counties. Especially our surrounding suburban counties. Delaware County is really just taken off with their vaccination rates. And I know a lot of them are getting vaccinated here in Columbus, though.
No, you're absolutely right. If you look at Franklin County numbers, they are just a tad bit better than the statewide numbers, but we are still under 50% of our population who's been vaccinated. So we have a lot of work to do. And even prior to the governor making this announcement last night, we've been working really hard with many of our community partners to try to get our residents vaccinated and going to where the residents are. So, we went to the Crew game last weekend. We've been going to rec centers. We're going to start going to shopping malls and to other events that are happening in our community to try to get people vaccinated. Everyone who is eligible should be vaccinated, and we need to be way over 50% vaccination rates for there to be a little more comfort on my end for removing these health orders.
What's that number for you?
Well, I would a minimum of 50% vaccination rate, a minimum. But if we could get to 70%, I would be very happy.
So today, just about an hour ago, was a big day. You guys started vaccinating 12 to 15-year-olds. How big of a difference is that going to make in getting to the goal of 50 and 70%?
Well, it's going to help for sure, particularly if parents bring their kids in. And hopefully now there will be some families that now know that everyone in their household can get vaccinated. So they might come in now and not only get themselves vaccinated, but now get their kids who are over 12 and up vaccinated. So we're hoping that we see an increase. And talking to some of my vaccine providers in town, like the hospitals and some large health systems, there seems to be an increase over the last 24 hours of people signing up to get vaccines. I hope that momentum continues, and we really start to see that when we look at our vaccination rates here in Franklin County.
Whenever they made that announcement last night that we were good to go with the 12-year-olds, were you encouraged by that?
I was. I mean, to me, it was just like the rubber stamp. We were anticipating that. And so we were ready to go as soon as that came through. 12 to 15-year-olds are just mini adults, really. And so the vaccine should be just as effective, if not more effective, in that population. So I think as we can expand those who are eligible for the vaccine, that will help us get to this goal of being over 50% and as high as even 70% vaccination rates.
What is your message to parents who know the statistics of the 12 to 15-year-old age group, knowing that they aren't as heavily impacted? A lot of them are asymptomatic carriers. But what is your message to them as to why they should be vaccinated despite kids really not seeing a ton of symptoms? However, we have seen some really extreme and sad cases where kids have died.
Yeah, we have had deaths in the pediatric population. We've also had hospitalizations in the pediatric population. So this is not a population in our community that is immune to COVID-19. But what you said is very true, that teens can be carriers, kids can be carriers of this virus. So it's important to get them protected, because if they're carriers, they could infect others in their household who have chronic health conditions, who have reduced immune systems. They can affect others outside their household. And so as we think about the summer, and as we think about lifting these health orders here in Ohio, it's very important that we get everyone who is eligible for this vaccine vaccinated. Whether you think your risk is low or high to getting COVID-19, it really doesn't matter, because we as a medical community have not been able to identify why some children are at increased risk for COVID-19 versus others.
So there's only about 2 to 3 weeks left of school. I know schools have been vaccinating kids. Once school ends, what do the efforts look like for as far as Columbus Public Health to getting to these preteens and teenagers with the vaccine? Are you guys going to be holding clinics, going to camps? What's the plan?
All of the above. So we're going to be working with our Rec and Parks Department here in the city and going to some of their camps and their rec centers to provide the vaccine. There are some schools within Columbus City Schools that will be open during the summer. So we'll be working with them, as well as be working with some of the facilities that might be closed, but are in the neighborhoods where we can go to. We're going to be going through the neighborhoods with our mobile unit, which we hope to get here in the next few weeks, and vaccinating people right in their neighborhoods. And as I said, we're going to be going to events and shopping centers where we can capture adults and children who are eligible for the vaccine and get them vaccinated. Really, we're looking at any and all possibilities of where we can get our community vaccinated, because that is the key. The health orders might be lifted, but we're still in a pandemic, and it's still important that people practice some of those good behaviors that they've been modeling for the last 15 months. We need that until we can declare this pandemic officially over.
I do want to move on and talk about these incentives that everybody is buzzing around about. 5 Ohio adults will win $5 million in a lottery, and then 5 kids will win tuition to one of Ohio's universities. What are your thoughts on this? And do you think it's a good idea, or do you think perhaps there might be a better way to spend $5 million in public health?
Well, I think we've been thinking of all different kind of ways to incentivize individuals to get vaccinated. I know here at Columbus Public Health, we've been looking at a lot of different options to incentivize our residents to get vaccinated. Everything from giving free footballs and free basketballs to giving back to school supplies to giving a free pizza. So there are a lot of different ways to incentivize people. I'm trying to be optimistic that this will work, because we need people to get vaccinated. And if this works, I take it. But the bottom line is, at the end of the day, I want as many people who live in Columbus and Franklin County to get vaccinated. And whatever it takes to incentivize them, I am supportive of that.
I do want to go back and talk about our hospital systems. I remember Governor DeWine mentioned last night that a very, very high number, like 95 or 99% of people who are hospitalized with COVID-19 right now have not had the vaccine. Can you elaborate a little bit more as a medical professional about those numbers and about what you guys are seeing with vaccinated versus unvaccinated people in the hospital?
So that's a great question, and one that has come up to us. And, to be honest with you, that is not something that is required documentation. So when a patient is hospitalized, obviously now the hospitals are asking questions about, have you been vaccinated? When someone's hospitalized with COVID-19, they're asking, have you been vaccinated? But there is no reporting system currently in Ohio that captures hospitalizations and vaccination rates. So that's something that we here locally are looking at and trying to gather some of that information. But from my conversations with our hospital CMOs, they are not aware of any significant number of individuals who are hospitalized with COVID-19 who've been fully vaccinated. So I will, support the data and support what Governor DeWine says, that yes, those who are hospitalized are not vaccinated. Again, another reason why you should get vaccinated.
Let's talk about Columbus specifically, because it is its kind of own island, the 3 Cs versus different parts of Ohio. So Columbus, we've got, huge events potentially. We've got Clippers, Jackets, Crew. They're all playing right now. And Columbus has been a little bit stricter as far as health orders goes. We had a mask mandate here in the city a lot earlier than the statewide one. Do you guys anticipate perhaps keeping that? And has that been discussed after June 2nd?
So obviously we all just found out about this last night, just like everybody else. And so we're still exploring what that means legally for us as the city, and what our city council's order means for masks, and where we go from here. I would just really echo what the mayor shared with everyone last night, is that these public health practices that have been orders that we've been doing for the last 15 plus months are good practices. And we should continue, when necessary, to practice those and continue doing those behaviors. And I'm hoping that we don't need orders for people to do the right thing to protect not only their health, but the health of those around them.
different than a stadium event, of course, is the memorial. I know it's a little bit outside of Columbus, but a lot of Columbus people go there, the vast majority. What are your thoughts on that happening soon? And do you think it's safer or less safe as being an outdoor event? I know they had been requiring masks before, but with the new CDC guidelines and the health orders being lifted, I don't know what they're considering at this point. What would your advice be to them?
Well, again, I would just remind people that we know outdoors is safer than indoors. Most of the events at the memorial are outdoors, but there are some things that are indoor. And then I would just say, we don't have 50% of our population vaccinated yet. So there will be people around you who have not been vaccinated. And those are the people who are at greatest risk. Those who are not vaccinated, once people stop wearing masks, they are going to be at increased risk, even higher risk than they are today, of getting COVID-19. So I really strongly encourage people who want to partake in those type of activities to get vaccinated.
All right, and I know it's creeping up on us, and a lot of people want to know, what about red, white, and boom? What are your thoughts on that? Do you think it's going to be safe? Do you,
Well,
what are your thoughts?
Well, again, outdoors is safer than indoors,
Mhm.
but red, white, and bloom tends to have a lot of people compacted in a small area. And a lot can happen between now and July 4th weekend. As the governor shared yesterday, our case counts are going down and it's a pretty steady trend. If we continue to see that trend for another 6 to 8 weeks, then 4th of July weekend, we might be singing a completely different song than we are today. So we need our rates to go down, and we need our case rates to go down, and our vaccination rates to go up.
All right, Dr. Roberts, anything that I have not asked you that you would like to touch on today?
I would just want to remind people that the pandemic is not over. We are in a much better place than we were before, but the pandemic is not over. But there are some key things that we can all do to help us get to the other side of this pandemic faster. And the first and foremost thing is, if you have not been vaccinated, get vaccinated. And if you have been vaccinated, encourage someone in your circle who has not been vaccinated to get vaccinated.
All right, guys, Dr. Roberts, thank you so much, as always, for taking the time to talk to us. We will be posting this full interview on NBC4i.com. If you didn't catch it live, it'll be there in just a few minutes, and then we will have clips of it on NBC4 midday here in about a half hour. Really appreciate your time, Dr. Roberts.
Thank you.
See